A semblance of the old life in Nigeria's commercial nerve center, Lagos, now prevails. Most worship centers are opened to congregants, while secondary schools are attending to final year students. Activities at the motor parks and airports are picking up with strict adherence to the COVID-19 protocols for safety as criteria for general well-being. In summary, human interactions in the center of excellence is becoming robust. However, there are fears in many quarters that this could lead to a spike in coronavirus cases. How can a new wave be averted? And what more steps can government actually do, as well as individuals, to take the figures from staggering? Our discussion is tailored in this direction on Panorama Today, coming to you from the NTA Lagos Network Center. I am Dotun Ogunyemi. Thanks for joining us. And let's begin with latest developments in Mali, where talks aimed at resolving the political situation in the aftermath of last week's coup have ended without an agreement. The country's new military leaders and West African mediators wrapped up days of talks without settling on how to return the country to civilian rule. Leader of the ECOWAS delegation, Nigeria's former president, Goodluck Jonathan, disclosed that Ibrahim Boubacar Keita indicated that he wasn't forced to resign as president, and neither does he want to return to power. Goodluck Jonathan added that lifting the sanctions imposed on Mali was discussed by both parties, with plans to address the issue at an extraordinary summit of heads of states and governments of ECOWAS scheduled for Wednesday. Meanwhile, the Malian junta has promised to release other personalities arrested when the security situation in the country is stable enough for that move. The United Nations has commended the Buhari administration for the giant strides recorded so far in the fight against insecurity, indiscipline and corruption, which it describes as critical towards placing Nigeria on the path to a sustainable future. The UN resident and humanitarian coordinator, Edward Callon, announced this during a courtesy visit to President Muhammadu Buhari. State House correspondent Adamu Sambo has details.
I want to start by commending you and the people of Nigeria.
Leading the heads of 5 key United Nations agencies in Nigeria, Mr. Edward Callon was in the State House to formally appreciate President Muhammadu Buhari for his administration's continued support to multilateralism, especially the investment in rebuilding and modernizing the United Nations House in Abuja, bombed by Boko Haram before his coming to power.
Your Excellency, the reopening of the UN House was an act of defiance in the face of terror and attack on our core values of peace, freedom, prosperity, tolerance, and justice.
The United Nations team discussed various topical issues with the Nigerian leader and commended him for providing desired leadership and guidance in the response to the COVID-19 pandemic, achieving a polio-free Nigeria, restoring security and stability in parts of the country, as well as promptly providing humanitarian support to those in need.
We are impressed with your efforts and changes you have made in security under your administration. We can see the progress that has been made, but we want to encourage you and your administration to complement the ongoing military effort with dialogue and a political process in the search of a durable solution. We also admire your leadership on the Lake Chad Basin, especially investing in recharging the Lake Chad Basin. This is a Pan-Africanist investment and need urgent attention by ECOWAS, African Union, African Development Bank, and other development partners. The UN will continue advocating for this investment to support a civilization of over 33 million people depending on the Lake Chad Basin.
Mr. Callon said the United Nations agencies are also impressed with Nigeria's renewed onslaught against corruption as bane of socio-economic development in the country.
We commended the President on his resolve to reform and return discipline in the public service, as well as some of the success he has achieved in trying to fight corruption. It is not only a fight of Mr. President or institution. Everybody has a stake in fighting this menace in society today.
President Muhammadu Buhari welcomed the show of appreciation by the United Nations for his administration's genuine efforts at dismantling obstacles to national development. He promised not to relent until Nigeria is placed on the path to sustainable future, but called for continued support of the United Nations.
I'm very grateful that the United Nations has put up such a formidable team that is dedicated to helping us. I assure you that we'll continue to participate as much as possible to make your job feasible and comfortable. And please do not hesitate to inform us whenever there is any need in the course of your assignment here.
The president appreciated the various programs of the United Nations in the country, especially for women and children, describing them as impressive. During the engagement, the Minister of Health, Dr. Osage Ihanere, as well as that of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, gave further details on areas of collaboration and cooperation between their ministries and the UN agencies. From the State House, Adamu Sambu, NTA News.
As we talk, critical stakeholders in the Nigerian digital switchover project are assembled for a special meeting to take a look at the journey so far, as well as identify way forward. Key issues on the agenda include DSO's indebtedness and funding, as well as DSO rollout timeline. The meeting is being attended by the NBC, Digiteam, BON, set-top box manufacturers, InView, Renmo and SES, one of the world's leading satellite operators providing satellite signals for the project. International flights this weekend. The Presidential Task Force on COVID-19 says travelers must present a negative PCR COVID-19 test conducted 7 days to boarding. This forms part of reviewed aviation protocols by the task force following concerns over the validity of some COVID-19 test results tendered for some evacuation flights. Mitairi Ikben reports on Monday's briefing in Abuja.
The euphoria preceding the resumption of international flights is yet to abate, but the Presidential Task Force is taking cautious steps to prevent importation of coronavirus and community spread, which will necessitate periodic review of the protocols.
Unfortunately, the validation process for the pre-boarding PCR tests have shown, for instance, in Lagos on Saturday 20th, that stood at 404 of those cases. 64% came from evacuees and the people who were returning from other countries.
Airlines will be fined $3,500 per passenger if they fail to comply with pre-boarding COVID requirements. These passengers may be sanctioned with inclusion on a travel watch list or their electronic passports suspended for a period of time.
Modalities for school resumption are still in progress, while health workers are advised to maintain a high index suspicion for COVID-19 in the course of duty.
I urge you to just bear with us a little bit more. We'll then announce when others can resume.
We continue to intensify our efforts to train all frontline responders on the effective implementation of the infection prevention control measures.
The part of the training, again, is a judicious use of PPE so that you can also combat infection.
Although Nigeria's COVID-19 death toll has risen above 1,000 within the last 6 months, the Presidential Task Force on COVID-19, however, indicates that there is a steady decline in case fatality rate, which is now put at 1.92%. In Abuja, Mitaire Ikben, NTA News.
While the Nigeria Center for Disease Control has confirmed 321 new cases of coronavirus in the country as at the 24th of August, bringing the total number of confirmed cases to 52,548. The new cases were recorded in 23 states and the FCT. The breakdown shows that Lagos recorded the daily highest number of cases with 98, followed by the FCT with 34. Kaduna has 30, Nasarawa 25, Benue 21, Plateau 17, Rivers 15, Adamawa and Ogun States have 11 each, Enugu 9, Edo 8, Delta and Ekiti also have 7 each, Gombe has 5, Ebonyi 4, Bayelsa, Kano and Ondo have 3 cases each, Cross River, Imo, Kebbi and Niger States recorded 2 cases each, while Abia and Bauchi have 1 case each. The total number of patients discharged so far stands at 39,257, and sadly 1,004 deaths have been recorded. More residents of Lagos are becoming worried following the refusal of some patients with COVID-19 to submit themselves for isolation, as they believe this could lead to an increase of the disease in the state. Nosa Usula reports that the effects of the total lockdown caused by the virus are still fresh in their memories as they appeal for quick government intervention.
Several reports from across the country reveal how patients with COVID-19 avoid submitting themselves for treatment at designated isolation centers and in some extreme cases break out from the centers after being admitted.
People are really scared. They are thinking maybe the isolation centers are not real, and then something going around saying that this coronavirus thing is not real. So some people feel they don't have it. Some people actually have to go out daily to hustle for their means of livelihood, so they won't want to stay at home for a whole 14 days. They prefer to go outside and look for what to do.
Lagos remains the epicenter of COVID-19 with about 16,000 confirmed cases of the disease. Lagos State Commissioner for Health, Professor Akin Abayomi, who revealed at a press briefing in July that over 2,000 patients who tested positive for COVID-19 in the state have not turned up for admission at the isolation centers, stated that government had adopted home-based management of asymptomatic and mild COVID-19 cases. Chief Medical Director, Lagos University Teaching Hospital, Professor Chris Body, while sharing his experience with patients who had refused isolation and treatment at their facility, explained that patients with COVID-19 who are on the run and fail to submit themselves for isolation or do not properly isolate themselves when placed on home-based isolation are capable of truncating government's efforts to contain the spread of the deadly virus.
What we have done at the Lagos University Teaching Hospital, and which Lagos State has done very well too, has been to set up what we call an emotional and psychosocial support group. This is a group of psychiatrists, psychologists, and people who work in that area, so that our doctors, our nurses, our psychologists, our psychiatrists call such patients who are being violent or who are being rejecting or resenting the very process of isolation, and they counsel them, and you should see the result. It's marvelous.
Patients with COVID-19 were advised to desist from such acts, as the country would record more transmission of the COVID-19 infection if more people continue to flee from being admitted or do not properly self-isolate when placed on home-based isolation. In Lagos, Nosa Osula, NTA News.
Joining us via Zoom to talk about the strategies for averting a coronavirus surge in Lagos is the Director General of the Nigerian Institute of Medical Research, Professor Babatunde Salako. Thanks for joining us.
Thank you very much for having me.
All right, let's talk about what the current situation is between Lagos and the COVID-19 pandemic.
Well, what we seem to be seeing in the last few weeks is that the numbers seem to be coming down compared to about 2-3 months ago. And the admissions into the isolation centers has also reduced drastically. There are not many people receiving treatment at the isolation center. This can mean one thing, that generally the transmission rate is going down, and so the case is beginning to go down. Others will feel that perhaps we have reached the peak, or we're about reaching the peak, and then the curve will begin to flatten, as it were. But then we can also look at the current situation where a lot of people are managed at home, and therefore made the isolation look like there are no people there. But then the number of tests, the number of tests has increased, at least in the last 4 to 6 weeks. The number of laboratories has also increased. So we are testing much more than we were testing before, and yet we are not detecting as high as we were detecting about 2-3 months ago. So it looks like we are beginning to see a drop in the transmission rate, looking at the number, and that perhaps in the next few weeks the epidemic curve graph may begin to flatten, and it may be on its way out, as it were.
And with the reopening of so many other sectors, particularly worship centers, the airports, and other public places, what do you project as the likely outcome? Are we expected to see a surge?
Naturally, we should expect to see a surge, because these are areas where a lot of people will have to socially interact. And as it were, you notice that practicing social distancing has become very challenging for us. Many of our cities are choked, and when you talk about religious houses and then all our social events, it's very, very challenging to practice social distancing. So we should expect that when this ease is left up, the transmission may increase much more than we are seeing now. And that may look like a second wave, but it may not really be. It may just be because of that set of lockdown that has just been eased off, and people are beginning to interact, and so infection rates may also go up. So what we need to do to mitigate that is to step up the awareness campaign about the use of non-pharmacological interventions, the same hand washing, use of sanitizer, use of face mask, and proper respiratory hygiene. Okay. We must continue to tell people, especially now that we are going to allow a lot more people to interact together.
And from the experience of other countries, when some densely populated cities were reopened, they experienced a surge. In the case of Lagos, what can we do to prevent such occurrence?
Yeah, what we can do is what I've just said, especially in the area of schools. I think there has to be some kind of training for school proprietors about how to ensure that the non-pharmacological interventions are put in place. And where they believe the government feels that they may not be able to do it, they may also need government's assistance. But I think training of those schools proprietors and those who manage the school must come first before the schools are reopened. For religious houses, the same thing can happen. And for them, it must be on top of their preaching. Either in church or mosque, they must talk about coronavirus, the infection, the impact, and what they need to do to prevent infection. And the religious houses must also be seen to employ or deploy non-pharmacological intervention. That is the only way we can reduce the rate of transmission during this period.
Now, Professor Salko, we cannot talk to you without again questioning or asking you what the role of research is in all of this, and what your institute is doing presently in terms of management and a possible cure or vaccine for the virus.
Well, our institute has been in the forefront of research since this pandemic started. And you will recall that we did sequence the first case that came to Nigeria in February. And since then, we have tried to monitor some of the infections, looking at some people with severe infection and some people with mild infection, sequencing their viruses to see if we can detect any mutations. And there are one or two mutations that have been seen, not different from what has been seen elsewhere, but it's around the spike protein where the virus used to elicit immune response. And this is the area that everyone is looking at to be able to come up with a vaccine. For us, we are in the lab trying to experiment to clone that spike protein and then see if we can try it in a tissue culture lab or a cell culture to see the response that the clone part of the virus can provide. Now, the idea is to see if we can elicit immune response from the cells, and then we can take it on and go to animal trial. We are at that stage now, and I believe that giving some time more and support, we will be able to come up with something.
Now, the next question is one that is bugging the minds of many really around the world. Is there a vaccine anywhere in the world right now?
There is no vaccine that has been accepted by the WHO, but there are vaccines that are close to clinical use. Of late is the one that was registered by Russia, which has passed maybe phase 1 and 2 trial only. Of course, that has been registered in their country. It will have required a phase 3 trial where the vaccine is tested among hundreds of thousands of people to be able to determine if indeed it can elicit immune response and be protective and safe among a large number of people, including different ethnic backgrounds. But that has not been done. For whatever reasons, they stopped at stage 2 and they have registered it to use. At that stage, they must have proven that the vaccine can elicit immune response because it must have been tested against what we call placebo. That is using nothing compared to using their own vaccine that they did. And it must have shown some level of safety for the government of Russia to do that. The other one is the one tested by Oxford. That is still ongoing and nothing really has been heard about it. Vaccine production takes quite a number of years for it to become useful. But what we have now is a pandemic that requires very quick solution. So everybody is on the field trying to see if they can come up with something. Hopefully, the way it's going, maybe we'll get one in the next 6 months or thereabout, but certainly none is working now.
Thank you so much, Professor Babatunde Salako, for your time and also your work on the COVID-19 pandemic.
Thank you very much for having me.
And you're also watching Panorama coming to you from the Lagos Network Center. Let's now take a break.
Coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Many thanks for staying with us. Let's now get the latest in the world of sports.
Football analysts continue to